Hello, everyone. Good morning, good afternoon, good evening, wherever you are in the world. Welcome to Meet Menaca to celebrate you. Thank you so much for being here. Today, we are having another special speaker to speak about can arthritis be cured? He's Dr. Navaratnam. He's MBBS, MRCP, FRCP, a consultant rheumatologist, consultant physician, rheumatology and rehabilitation. He has practiced as a consultant for almost 50 years. He did his MBBS from Ceylon as a top ranking student, first Sri Lankan Tamil to be appointed to NHS as a consultant in medicine, renowned and astute diagnostician, and highly respected clinician who has, for a few decades, who has been a consultant clinician. And he's socially conscious, loves Tamil language, and spiritually inclined. And he's a past chairman of SCOT in 1980 and also a founder member. And he led the delegation to Mrs. Indira Gandhi. And also he is part of many religious organizations and social initiatives. And it's a pleasure, honor, and we are really humbled to have you as the speaker. Before we go into the show itself today,
as we know, His Royal Highness the Prince Philip, Duke of Edinburgh, passed away yesterday.
In respect to him, I just thought we will observe a minute silence.
May
his soul rest in peace. Thank you so much for everyone for observing the silence with us. And let's welcome to the show. Hopefully, it's another Saturday afternoon. We are here to listen and learn from someone who has been experienced in the field for many decades. So, Dr. Navaratnam, we all know someone who suffers from arthritis. In reality, how common is it really?
Good evening, everybody. Thank you, Menaca, for your kind words. And I am so pleased to be able to share some of my knowledge that came from learning and experience. And arthritis, as you know, is one of the commonest ailments that the population in the world suffer. About 1% of the population have some form of arthritis during some time in their life. So it is really, it counts to several millions. And arthritis is a word that's used for painful joints. There may be other features as well. Inflammation is one of the important features of arthritis. Any word that ends with ITS in medicine implies inflammation. So pharyngitis is inflammation of the throat. Tonsillitis, inflammation of the tonsils. Arthritis, inflammation of the joints. But arthritis is used loosely for painful joints, even if there is no inflammation. Coming to the word arthro, arthro means joints. And now in Darwin's theory, arthropods come far down in the evolution. Human beings are one of the highest beings in the world who have got joints. They move around with jointed limbs. And there are other joints that are not moving, but still joints. And in the human being, the joints are between two bones. So wherever there are two bones meeting in the human body, there will be a joint. So any condition that affects these joints can cause pain or other symptoms. We call them arthritis. Now, there are two main types of arthritis. One is degenerative, the other is inflammatory. Although there may be overlap between the two in real life. But the degenerative arthritis is otherwise commonly called osteoarthritis. It's characteristically due to degeneration or wear and tear of the lining of the bones when two bones join. And this wear and tear causes pain, loss of use, and difficulty in doing common things. And this can affect large joints and small joints.
Sure. Thank you so much, Dr. Navaratnam. So, we have 247 joints in that. That's all I know. I have limited knowledge about anatomy compared to you. So, can this arthritis affect anywhere? Is it, because you mentioned some joint can be moving, some joints don't move, and it can be anywhere. So, does the arthritis affect all the joints randomly, or does it affect exclusively some joints than the others?
That's a good question. Any joint that moves only can be causing symptoms. Now, in the skull, there are bones, several bones that join up to form the skull. They don't move, and there's no inflammation. There may be afflictions, but not arthritis. And there are some joints that move, but don't suffer inflammation very often.
Sure. Thank you so much.
That the cricoarytenoid joint, that is the larynx.
Okay.
There are little joints there that rarely suffer from arthritis.
Okay. I learned something new today. Thank you so much for that. So before we go into details of each section of arthritis, can I just ask you, what are the common causes for them? Because, as we said before, most of us at least know someone who has arthritis. So what are the causes behind it really?
Now, mainly, as I said, osteoarthritis is caused by degeneration. And the degeneration may have in different age group, different people, different causes. Now, in young person, to get osteoarthritis, they must be misusing their joints or having some trauma where they crack or fracture near the joint, and then they develop arthritis much earlier than in old age. And so there are vitamin deficiencies can cause joint swellings early. Then we don't call them osteo, but mimic osteo. So the osteoarthritis main cause is aging process. There are genetic causes, there are metabolic causes, and trauma.
Sure.
Now,
go on. I'm sorry. Apologies.
As opposed to that, the inflammatory arthritis has got many examples. There are 100 types of inflammatory arthritis. And the commonest one is rheumatoid. But there are other causes of inflammation, such as infections, and there are several types of infections can cause arthritis. Then there's autoimmune diseases, and rheumatoid is one of the commonest autoimmune disease, which is most difficult to treat and the most prevalent. And then there are deficiencies of vitamins. Then there are rare infections, viral, bacterial, TB, sarcoid. You can count a large number, of course. You mean leprosy, which is rare in the developed country now. And in India and Sri Lanka, I have seen arthritis due to leprosy. So arthritis, inflammatory arthritis, can be due to several causes, but we'll be talking mainly about rheumatoid and autoimmune conditions. Again, apart from arthritis, rheumatoid arthritis, there are other autoimmune conditions such as systemic lupus erythematosus, one of the dangerous killer disease, which often attacks young women. And it is again genetically predisposed people, but their autoimmune condition is very serious. And although about 20 years ago, treatment was very difficult, but now with the advent of new medications, the lifespan of people diagnosed with lupus can be near normal. They can live up to 80 years with good management. So autoimmune diseases is another group of diseases that cause arthritis.
Sure.
Okay, you can ask me some.
Thank you so much.
I can go on talking for 1 hour. So let me let you talk.
I am trying to pack as much information as possible in that 1 hour. That's what it is. So we hear about osteoarthritis and rheumatoid arthritis. We have, and you have mentioned that they are the main two categories or more common categories. I know there are more, hundreds of them perhaps, but can you give some insight into how many more different kind of arthritis are actually out there?
Yes. As I counted, there can be, apart from rheumatoid, a similar disease is psoriatic arthritis. That's linked with skin psoriasis and is similar to rheumatoid, but the joints that are affected, the way it presents is different. And the treatment is also slightly different. That is, then gout, metabolic arthritis. Gout is again a rich man's disease, but now even poor men do get it because they take alcohol. Alcohol can precipitate gout. Gout is due to excessive uric acid in the blood. And the blood, it goes and deposits in joints, and due to various disturbances, physical and emotional and chemical, gout can precipitate. The famous gout sufferer was Henry VIII, as you know. Mm-hmm. Henry VIII was a famous gout sufferer. Yes. And the man who helped to ease his pain got knighthood those days. So gout is a very important but treatable condition and a preventable condition, which is a very unusual thing. Then there is another thing called pseudo-gout, where there is gout-like symptoms, but the crystals that are in the joint are not urates, they're calcium pyrophosphate. That not that common, but it is there. Then there are other metabolic causes, which are rare metabolic causes, ochronosis, hematochromatosis. These are all metabolic abnormalities that can present with arthritis.
Yes.
Then we have got this autoimmune diseases. That's a big group, and by far that is the commonest, apart from osteo. Osteo is the commonest because osteo can affect everybody, and anyone over the age of 60 or 70 may have some form of osteoarthritis in some part of the body, base of thumb, big toe joint, or weight-bearing ankle joints can be affected in people and can be controlled with treatment. So that's osteo. So osteoarthritis is the commonest form of arthritis in the world. Second commonest is rheumatoid. And rheumatoid is autoimmune. And autoimmune is a big subject. That is, immune system in our body consists of cells and chemicals, humoral and cellular immunity. Cells are T cells and B cells. They are special white cells. And they may walk around in the blood like ordinary policemen. But when they are irritated or when there is something that upsets them, they become aggressive. They become soldiers. And they go around attacking the foreign substance. That is the function of immune cells. They not only attack by engulfing the bacteria or virus, they attack by producing chemicals that will make them susceptible to be swallowed by immune cells. Now, in rheumatoid and other autoimmune diseases, what happens is the immune cells do not recognize their own tissue. And in rheumatoid or in inflammatory arthritis, the immune cells mistake the lining of the joints, the membranous lining called joint membrane or synovium. The synovium is the target in rheumatoid. And the immune cells target that synovium and cause inflammation. And that inflammation produces inflammatory cytokines, we call it, substances, chemicals that can cause pain, disturbance in circulation in that area locally, increased circulation, increased blood flow, and secretion of extra fluid, and that causes swelling of the joints.
Yeah.
So when a knee joint is attacked like that, you get a small, nice knee, becomes like a football, so big, so painful, so inflamed, and you have to go to the A&D to get this sorted out. So that is how arthritis develops in autoimmune disease. I talked about knee joint. It can happen in all synovial joints.
Okay. It's really important that you said that, it can start. So, because these are the important one. How can someone know they might be having rheumatoid osteoarthritis, for example? Because it's a very good point you said that, the knee can swell up and they might not be able to walk around. Is there anything else people can actually look out for as a layman and think, oh, it could be arthritis? I heard, Dr. Navaratnam speak about it. Maybe I should go and get it checked.
Onset of pain is one important symptom. Then stiffness after rest, another important symptom of inflammation. And then pain on usage. And sometimes warmth on the joint and tenderness and pressure. These are the cardinal symptoms that make you suspect that you may have arthritis. And in large joints, yes, walking or getting up the stairs may be painful. And then you suspect if it's arthritis, you suspect it, you go for an X-ray. In degenerative arthritis, X-ray may show some changes, but in the early stages, may not show any. So then you have to have a scan. Nowadays, you have got ultrasound scan, MRI scan, and CT scan. Any of one of those scans will show abnormality in the joint. And then blood tests. Now, when you go to a doctor or a nurse and complain about this, they'll organize a blood test. And in inflammation, there are markers called inflammatory markers, CRP and ESR, which will be elevated much more than normal. And then there will be other changes in the blood. And in rheumatoid, there's an antibody called rheumatoid factor. And anti-CCP, anti-CCP is more specific. If these are positive, then there's highly likelihood of rheumatoid arthritis. Then there are, for other autoimmune disease, there are some markers like anti-DNA antibodies. Some antibodies against skin proteins and things.
Sure.
Good.
Sure. Thank you so much. I know you have in-depth knowledge of this. So I'm just wondering, as a lay person, they know that, okay, they are having some joint pain. They have to go to the doctors. Is there anything in specific they have to mention? Or for example, if one of their parents had it, or uncles and aunts all had it, is it important? What is it? So the most important things for them to convey to the doctor so that, they're exactly telling what it needs to be told.
That's quite right. Heredity is an important thing in some forms of arthritis. Now, in rheumatoid, it doesn't really get passed on from father to son or mother to daughter, but there's higher incidence of autoimmune disease in that family. So if the mother had rheumatoid and if the daughter has joint pain, then there's high suspicion that there may be autoimmune disease. And therefore, family history is an important thing, and that is the duty of the nurse or doctor to inquire about it as well. Even if the patient doesn't say it, we always inquire about family history. So that's important. The other factors in the history we go through before we make a diagnosis. Anything else you want to know?
Yeah, because it's really important, like everyone speaks about arthritis, but we don't know usually at what point do we have to go to the doctor, or because we all have aches and pains, let's face it, right? Sometimes we have back pain, neck pain, once in a while, but when is it important for you to know, it might be just a bit more than just odd pain. We have to give that attention to you, and we have to make that appointment with your doctor.
Yeah, you are going right. If there is persistent swelling, pain and tenderness that lasts for more than 2 weeks in a particular joint, that needs to be looked at, and you have to see a doctor. And if the doctor suspects rheumatoid, he should send the patient and do some basic tests, and then refer to a rheumatologist who will do in-depth study and design a treatment program for the patient. And there are some patients who can be cured in the early, nipping in the bud. There are others may need long-term management, where the patient and the doctor form a partnership. And there are several advances in medication that have happened in the last 20 years. And so much so that when you ask the question, can arthritis be cured? Yes and no. Yes, some forms,
Yes.
and yes, with proper management, and no, some types of arthritis can be cured.
You gave me the perfect lead to the next question. Can some of the arthritis be prevented, or none of them can be prevented, Dr. Navaratnam?
I said about gout can be prevented. You can reduce the level of uric acid in the blood by taking anti-uric acid tablets, allopurinol, or adjusting your diet and habits and all that, dietary habits. Well, that is one disease that can be prevented and treated and cured. Infections like gonorrhea, gonococcal arthritis, you don't see it now, but I have seen it as a medical student in Sri Lanka. Maybe when I came to London also, as house officer, I've seen gonococcal arthritis. That can be treated and cured and prevented, telling the people to behave well. And there are other types of arthritis that can be managed, almost cured. If a knee is totally damaged, replacing the knee gives them about 70% of normal function, so which is almost a cure. And the hip replacements have really cured pain and stiffness in the hip of the majority of people. There's a place for surgery in degenerative and also sometimes in rheumatoid arthritis. So that's how we say about prevention.
Sure.
Treatment.
So thank you, Dr. Navaratnam. So you said some of them we can prevent, some of them we can only manage or treat, and then follow up and make sure they can have the best quality of life they can have. So how do you manage them, or how you have gone and talked about how we can prevent some of them, but when it is not preventable, we can only manage them. How do we manage them?
Now we leave the degenerative type on one side,
Sure.
and we leave the preventable, treatable conditions on one other side. And then we have got these autoimmune diseases. Commonest of is rheumatoid, and there is psoriatic arthritis, and then systemic lupus, and other rarer forms of autoimmune diseases. There we have a system where the rheumatologists have to identify them and sort of classify and find out how bad they are. Start with minimal treatment, like painkillers first, the onset of pain, and then physical therapy, exercise, early stages. Exercise is important in any stage of disease. In the early stages, they can exercise with isotonic or isometric exercises. You know about them.
Mhm.
Isotonic means you don't let the muscles contract, but you shorten or lengthen. The other one is so using different equipments, you can do that. That will help you strengthen the muscles. Strengthening the muscles also helps to ease symptoms due to osteoarthritis and any arthritis. So muscle strengthening, and there the physiotherapy comes. Physiotherapy is advice on exercise, and main thing is not to allow any joint to get stiff and painful and get fixed. So we have to move them, exercise. So early exercise and even late stage exercise using assisted hydrotherapy, very useful in early stages or late stages. Hydrotherapy not only helps to move the joints without stiffness or with the buoyancy, they also help to lose weight. So weight control is another important thing in management of all arthritis. And so the BMI try to advise on diet, on exercise, and on other aspects of life changing. Then apart from exercise, then we go on to anti-inflammatory medication. They do have side effects, but they are very useful in the early stages. They help to suppress inflammation. And steroids is one of the most powerful anti-inflammatory agents. And we sometimes use it topically or locally to one joint when just one joint is troubling. You can also use short course of steroids to treat polyarthritis or as an adjuvant to other medications, steroids. Then we come to another important set of medication called disease-modifying antirheumatic drugs. They are immunosuppressants. They suppress immunity because we know most of these arthritis are immune-based. So to suppress the immune cells, is like sending the soldiers to the barracks and to be trained to be kind and well-mannered. The immunosuppressants train the immune cells not to overreact to their own tissues. That is how these immunosuppressants work. And the commonest immunosuppressant we use is methotrexate. And 30 years ago, methotrexate was feared, but now it's the commonest. It will be prescribed about 6 weeks after diagnosis of rheumatoid. Or once the diagnosis is confirmed, we don't delay. Start with methotrexate. So methotrexate management has to be in the hands of GPs and nurses, advised by the consultant. And there are precautions, side effects, which teach the patient and the nurse and the doctor from a partnership. And patient will know. We give a booklet and even teach them about how to manage. And with methotrexate, some patients get almost complete cure before the joints get damaged.
Sure. Thank you, Dr. Navaratnam. Did I hear it right when you said methotrexate, you give it as early as possible? And it is an MD team, multidisciplinary team is involved. How early do you give it really? Because I know it is used for cancer as well, right?
Yeah, it was. It's an anti-cancer drug, but it affects cancer also, as you know, now an immunologically based condition. And methotrexate, now we introduce it as soon as we make a diagnosis and there are symptoms, then we don't delay. So it could be 6 weeks after onset of initial symptoms. By the time you go to the GP and then the hospital, GPs rarely prescribe methotrexate, but consultants do. And I sometimes initiate methotrexate and then tell the GP and then inform the hospital. Because the hospital waiting is sometimes 3 months or 6 months to see a new patient. In the meantime, the patient comes to me and I start them on methotrexate. The methotrexate is one of the important hallmarks of treatment of rheumatoid arthritis. Then there are other medications like sulfasalazine, hydroxychloroquine, are also useful disease-modifying anti-rheumatic drugs.
Sure. I mean, the reason I'm spending more time in the management of this arthritis is because most of them fall in that category, right? Because not many things can be prevented and it's in managing. I heard you mention it is a partnership between the patient and perhaps the family and the multidisciplinary team. What kind of role or how much responsibility does the patient has in managing that arthritis effectively?
The patient should learn within their limited, just about the medication and the disease, and cooperate with the patient, the doctor and the nurse. And we do have specialist nurses who only do this, talking to patients, advising them and monitoring them. And we monitor these patients so closely. Initially, blood tests every 2 weeks and then monthly, and then 3 monthly, while they are on methotrexate. And these results are put into a computer. And if there's a flagging up, even a secretary will note and then bring to the notice of the doctor or nurse. And once the system works, it is safe. I have not seen a death due to methotrexate while we treat for rheumatoid. So that's great. And then we have got other next line of medication. Those are marvels that have happened in the last 20 years. And they are molecular. Now, all this time we were treating and looking at arthritis as a bone and joint and disease and ligaments and synovium or pleurisy. Now we are looking at arthritis as a molecular disease. And we are looking at biochemistry and biologics. And the advent of biological treatments or intervention in the cytokines production or neutralizing cytokines, the big advance that have been made the last 20 years.
So can I interrupt you for a second and ask you what is molecular? Because most of the people, lay people, unless we are in the medical world, they might not know what does it really mean for a normal person, common person.
Now, our body has got tissues, epithelial cells, and then you get ligaments and muscles. Now, each cell has got chromosomes and chromatids and genes, all that. Mm-hmm. And these are made of carbon, hydrogen, oxygen bondage. And these basic bonds, when you come down to that, they're called molecules. The molecules are atoms joined up to form a molecule. Yeah. So.
Sure. Sorry, you were talking about pioneering, advancements in the treatment. Sorry, because I just wanted to make sure everybody understands and, on the same page as us. That's why. Thank you. Please continue with the.
I want to go back to this molecule.
Yeah,
in your chemistry, you would have studied this.
Yes, I did. I do know, to be honest, what is molecular studies, but I just wanted to expand it a little.
I agree. When I say you, I'm talking about the audience. Yes, sorry. Okay, that's the molecule. And so now we are really looking at the synovial, the chemicals that are formed in arthritis, and then attacking the molecules. First of all, we try to neutralize the cytokines. There were some drugs that came that we thought was a very wonderful treatment. And then a few years later, we found how to stop these immune cells activation. And antibodies, we call it monoclonal antibodies. These antibodies directed against each cell. And these drugs stop the cells moving and attacking the tissues. And these biologics are multiplying in a big way because research in this field is undertaken by several medical drug companies. If you leave it to government or NHS, it may not happen. Drug companies are pioneered, and it's their business, and they are selling these drugs at a very high price. But we are grateful to NHS because they have taken this and paying that money to the drug companies and making the drugs available under controlled conditions through the system in the NHS with the consultant-led clinical teams. When they recommend biologic treatment, it is given. And patients are lucky. They go into the hands of very pioneering consultants who start treatment early. Others will go and join some sleeping consultants who will wait till the patient is very bad to initiate these treatments. And we have got measurements called DAS scores, DAS score, disease activity scores. That the DAS score goes beyond a certain level. And we have already tried disease-modifying agents for a certain number of months or years. Then they are eligible for biologic treatment. Biologic treatment has revolutionized the suffering of rheumatoid patients. Even patients who had deformed joints became much able to use their joints and lead a more healthy life with these biologic treatments. So even though some people were born too early or developed a disease 30, 40 years ago, we are able to use biologics on them and make their life better. And it's a big business and a big advancement. And every night I sleep, I can hear about a new drug that's coming. And so it is one of the advancements, and we can say arthritis can be cured within inverted commas with these medications. Want to ask any more? Then the surgery, there's a place for surgery in damaged joints. Osteoarthritis, yes, knee joints, hip joints, blood suckers. They're even replacing shoulder joints. There are shoulder surgeons in the United Kingdom. We choose them and send shoulder problems to them. They may be in Surrey or in Manchester. And shoulder surgeons, elbow surgeons, temporomandibular joint surgeons. They only do that, and they're experts on that. And then feet surgeons, ankle surgeons. They can repair damaged joints or replace some joints. Surgery, they can also be life-saving surgery. When there are unstable cervical spine, and then we can fix it. I've missed one thing called ankylosing spondylitis, which is another inflammatory arthritis, immune-mediated and hereditary transmitted. Well, and that is not so common. About 10% of arthritics. There are 100 rheumatoid arthritics, you may say about 10 ankylosing spondylitis in the community. And they are young people. Their main symptom is back pain, stiffness, and unable to straighten up in the mornings. If ignored, the whole spine gets affected. They get what you call stooping back syndrome. They walk with the stick and not able to raise their heads up. That is, you don't see that anymore. People now get effective treatment for that condition.
Thank you so much, Dr. Navaratnam. It's so good that you mentioned about ankylosing spondylosis, because is there some occupations prone to these things more? Because I know a few dentists who suffer from back problem and neck problem, including myself in the past. So is there a predisposing factor for such an occupational hazard to these things?
Yeah, spondyloarthritis is a type of arthritis that affects the spinal joints. And degeneration of the neck bones, vertebrae, and the backbones does occur, and it's aggravated by certain occupations. Now, the dentists often work bent forwards and holding their head in one position and concentrating on the client's teeth rather than on their own neck pain, and they ignore that they're doing exercises. Therefore, the incidence of cervical spondylosis and lumbar spondylosis is higher. And the same with veterinary people and other factory workers who often have to stay in one place, and line workers often get arthritis similar to that. So you are quite right. It's an important factor. Yeah.
Thank you so much. Another factor you mentioned was infection, and I couldn't let it go. Other than speaking about COVID, does the COVID can it be a cause in future, or is it already evidence emerging that there's a connection between COVID and arthritis, Dr. Navaratnam?
Yeah, that's a very topical subject. I've been closely reading about COVID and the side effects or after effects. The patients, some patients with COVID have joint aches and pains. Even after vaccination, some people seem to have a temporary aches and pains in the joints. But so far, there's no inflammatory, persistent inflammation in the joints yet. But we have to wait and see. We know that some viruses, measles, mumps, and rubella, they can cause temporary arthritis. They cause arthritis that comes and goes. And COVID could do. We have to wait and see. But so far, no.
Okay. Thank you so much, Dr. Navaratnam. I know that you had to pack so much information in just a few minutes. Can I ask you one last question? What are the 3 things you would like our audience to remember regarding arthritis today when they leave this platform?
Spot any symptoms that persist early and seek advice. Keep your weight under control and do regular exercises. Yoga Piyasam. You wouldn't believe, don't talk about my age, I do Yoga Piyasam now. And improved breath control and exercising all parts of your body. Neck, shoulders, elbows, wrists, fingers, hips, knees, back. You must exercise them daily, depending on your ability. I wouldn't ask somebody who can't get out of bed to exercise. They can move their feet or hands. So exercise is an important bit you must do. And then, I said, weight control and spot early symptoms and seek advice. That's all I can, 3 things, yeah, there.
Sure. Thank you so much, because I think sometimes I wonder whether your generation has got it right. My dad still does meditation and yoga and everything, and he definitely keeps his weight under control. And I'm, of course, as you can see, just opposite to it. So it's something for me to learn. And there's no excuse for me not to do, because week after week, I'm listening to an expert coming and telling how important it is to be active and keep your weight under control. Thank you so much, Dr. Navaratnam. It was a pleasure.
I don't want to be rude and ask about your weight, but weight.
If you are willing to say your age.
Yeah, no, I'm willing to say my age. I control my weight. My weight is the same now as it was when I was 40 years old. And so, but when I was 20 years old, I was much lighter. When I married, my weight was 120 pounds. Now I'm 140 pounds.
Kudos to you. That's all I can say. And we wish we can learn something and take away one important message from there. Thank you so much. You have been a pleasure to interview.
I enjoy. I studied more than you all studied today. Well, I had to prepare how to use this time to instill. I think I've got about 30, 40 cards that I've written. I've not looked at them because they've gone into my brain. And of course, you ask questions, made it easy for me. Otherwise, I'll have to think of sort of topics. Thank you so much, Menaca. I do join you whenever I can, and I find your show very interesting. And you are a wonderful host. And I
Thank you.
wish you well, and I will continue to join you whenever I can. My daughter.
Yeah, I mean, a huge thank you for your daughter as well to get the technology running and making sure everything runs well. Thank you so much, because I know you have so much of experience and very learned, and it is a huge compliment to have you on the platform. So, and huge honor, and we are really humbled. So, following the tradition, we are going to go to announce the next speaker and the next topic for the next week. That is Dr. Deepti Joshi, practicing as a psychologist in Gujarat, India, for almost 20 years. And she is specialized in the technique of psychotherapy called CBT. So she will be speaking about nurturing better communication with children. I think that is really also another important topic we all have to face and we have to speak, because it's all starts and ends with communication. So I can't wait to listen to her speak. And I'm sure I have a teenage daughter, so I will be listening all ears to what she has to say as well. So before we go into the questions, I'm going to pass it on to Mr. Raj Rudran to give the vote of thanks. Over to you, Raj.
Dr. Navaratnam, you may be surprised to hear me.
No.
Menaca, audience, for your kind participation, and committee members. I've been asked to give a vote of thanks speech, and I'm delighted because I know Dr. Navaratnam very well. He's the man I call when I want some key person from his network to talk to me or do a favor. So that's that. And also, I don't get a chance very often to come to this meeting. Very useful, but unfortunately, I have a busy life too, and I don't get a chance. So here's an opportunity for me to be here too. So Dr. Navaratnam, what can I say? You gave us a brain dump in 40 minutes, 40 years. And most of it, I must admit, went above my head. But I picked up a few things. One of the things is the degenerative arthritis, my meniscus. So that's gone, I can't repair. I have to live with it. The second one, I can't prevent. That's the gout. So I had to cut back on the fermented liquid from the grape juice. So that I would do. But also, when you talked about the advancement in medicine, the molecular aspects and biochemical aspects, that's interesting to know. And because we don't get exposed to that all the time. So for you to give us all that, that's very interesting to know. So we see that, how the field is developing. So thank you very much for your time. Thank you very much for giving us the brain dump. And very useful. And I'm going to take care of myself too with additional exercises and weight control as well. The other person I would like to thank is the host. Thank you very much, host, for a wonderful presentation and hosting that show well. And the participants for your kind participation. And every program that we have, we get so many questions. Sometimes Menaca and the team are unable to handle that many questions. That shows the interest from yourself and your active participation. The last but not least, I'd like to thank the Meet Menaca committee. And on this occasion, I would like to read out their names, first names. That's so there is Menaca, Kirubai, Swati, Frank, Kanta, Dr. Kanta Niranjan, many of you would know, Rohan, Raj Madhavan, Vani, and Tara. Thank you all very much. And Julie, so without your help, this show wouldn't continue. And this show brings about so many different and interesting speakers on the health aspect, as physical and mental health, and also on lifestyles. So they're doing a great job. Thank you all very much. And I look forward to seeing you all, or most of you, at the next session. Thank you.
Thank you so much. So, the best way to get Raju to come to the show is to give him a vote of thanks. I've realized today. So you will be getting many more requests now. Thank you.
Thank you.
Thank you, Raj.
Thank
Nice
you.
to see you.
Same
Nice
here.
to see you. I should give you a private lesson.
You have already, I have had your consultation already.
We are all going to queue up, Dr. Navaratnam. However, right now, let's go to the audience questions. The first question is, are there any food or sports or climate which triggers arthritis?
Yes, that's very common. Climate, cold climate, the symptoms of arthritis is aggravated, but it doesn't increase the actual disease. Then warm climate makes the symptoms less, but doesn't cure or improve the disease itself. Food, yes. Good nutrition is important, and vitamin D intake often reduces symptoms in arthritis, vitamin D. So we make sure that you take adequate vitamin D, but not over the limit. The recommended dose of about 1,000 units a day is normal requirement. 400 is a normal, but we recommend 1,000 units with supplements. And a good nutritious food. We also find when people suffer from arthritis, fat-rich food not only makes you put on weight, but can also aggravate the immunological aspects. Therefore, we say don't take too much fat, and calorie control is important. All
Sure.
vitamins. Thank you.
Okay. Is
And
there any
exercise
sports?
also.
Is there any sports or climate which triggers arthritis, Dr. Navaratnam?
Sports, yeah. I mean, one has to learn to know yourself. Know thyself. You must know if you are having painful knee, you don't go and play squash. You try, avoid that. You may try golf or walking. Walking is the best sport that anybody can do. And the swimming or getting in the water and moving yourself is a great treat. That's important as a form of exercise. But jogging and running, a lot of people think it's good exercise. It's only when you are fit. I know people who jog, they won't give up, but they come with arthritic pains, and they may take medications. So one has to avoid exercise that's too much for yourself. And don't do weightlifting unless you are a bodybuilder. So exercise has to be controlled. Controlled exercise is often good. You go to a gym, the manager will ask, do a little assessment of your fitness and then recommend exercise for you. But when you're doing exercise at home, try non-weight bearing exercise or exercise that doesn't put too much strain on your joints. Okay?
Sure. Thank you, Dr. Navaratnam. The second question to you is, just a second, we have one more question. I will come to you. Does being a vegetarian or vegan help inflammation or arthritis? Is avoiding animal products and processes food help?
No. In fact, the elephant is a vegetarian and we don't think more arthritis or That's arthritis. Vegetarianism, as long as you take adequate food, is fine, and it doesn't make you any better with arthritis. But animal food is okay, provided you don't consume too much of fat. But fish diet, diet containing fish is good, they say, for immune mediated arthritis. Fish oil is good. So that is what I would say about animal food. Avoid too much fat, and gout is aggravated by often eating liver and kidney and all that. But that is because of uric acid content. Otherwise, being non-vegetarian is okay.
One last question before we come offline, and then you can ask. Yes, yeah, please ask.
Hyaluronic acid can it be given for multiple osteoarthritis joints, say at 3 monthly or 6 monthly interval?
And there is a treatment for osteoarthritis where particularly facilitated or treated hyaluronic acid that can be given intraarticularly. We use that for knee joints, which is very effective. And we even use for small joints, thumb joints and things. Hyaluronic acid, you can buy it, but it's a bit expensive stuff made by one of the...
Sure. Thank you so much.
What about the stem cells and plasma injection?
Yeah. Plasma injection for inflammation. Well, it's a sort of a research item, not practiced. Now, stem cell is for the future.
Okay.
Stem cell certainly will be a revolution in treatment of osteoarthritis. We can get stem cells to grow, and it takes time, and we may have to, prepare the patient to do the stem cell transplant. Now they are using stem cell transplant for life-saving organs.
Okay.
That's good. That's for the future.
Sure. Thank you so much. I know Logi has been waiting for a long time patiently, so I am going to give him the chance to ask the question before we go offline. Logi, it's over to you.
Just a question, Dr. About two things. You mentioned about uric acid.
Yes.
I have lemon, honey, and warm water every day.
Yes.
But my shoulder joints are hurting so bad. Is it something to do with that? Because I have a lot of lemon?
I don't think so. I don't link this type of nice decoction with shoulder pain. May not be linked. The shoulder pain, maybe you have to find out whether it is degenerative or...
Yeah, because I've been playing a lot of rugby before, so that could be the reason.
Oh, yeah.
The other one is I had my knee replacement done 15 years ago, both knees done. It's absolutely brilliant. And what I want to find out is just like knee replacement ball joint, can't they do anything similar on the shoulders?
They can.
But have they done it before here? I mean, but when I went to my surgeon a few years back, he said he can put plates there. I don't want any plates. I just want to know whether it's similar to the knee joints.
Yes, shoulder replacement is now very safe and very easily done. Whereabout do you live? Where are you living?
In Kingston.
Yeah, Kingston. There was a shoulder surgeon in Royal Orthopedic Hospital.
The one I did is the Epsom Orthopedic Hospital.
Epsom also, yeah.
Yeah. That's what I'm saying. I mean, I would like to have the internal plate. I like having a ball joint replacement on the shoulders.
Before they replace the shoulder, they would want to know if everything else has been tried, and they do partial surgery. That is, they may remove a bit of the acromion or clavicle, depending on whether the actual glenoid joint, that is main cavity, that is damaged, then they will replace it. And shoulder replacement is possible, and that pass certain criteria. before the surgeons will undertake. It's available on NHS. As long as 20 years ago, I've referred patients. They've had good results.
So thank you so much for people who are listening on Facebook. It is that time of the day to say goodbye to you. Hope to see you next time, same place, to hear Nurturing Better Communication with Children with Dr. Deepthi Joshi. Until then, stay safe, be happy, and keep smiling.
Thank you.